Hello friends, this is Dr. Rajesh, consultant medical and hemato oncologist working in Yashoda Hospital, Secunderabad. Today we will discuss something regarding breast cancer and why the treatment is different from different people. Majority of the patients do ask the common question, what is the duration of chemotherapy, which drugs to use, and whether hormonal therapy or targeted therapy is used in my case or not. So in the next 15 to 20 minutes we will try to understand and what are all conditions in which various forms of therapy is used. In breast cancer we use three forms of therapy. One is surgery, second one chemotherapy, third radiation therapy. Now first let us talk regarding the surgery. Surgery is the common modality of treatment for all breast cancer patients, all localized and locally advanced breast cancer. Whether to do surgery first or give chemotherapy first is usually decided in a tumor board. For example, if the tumor is localized or operable or a small sized tumor and it is located only in the breast which has not involved the underlying muscle or a skin or which has not metastasized to the lymph node, we call it as a operable breast cancer, in which usually we go for surgery upfront. Again, in surgery we have two options. One is complete removal of the breast, we call it as modified radical mastectomy, and second one breast conservation surgery. Which one to choose? From the oncology point of view, both breast conservation surgery and MRM, modified radical mastectomy, both are equal, but cosmetically BCT is breast conservation surgery is preferred over MRM, provided if the BCT surgery is amenable, and it is must to do surgery in all patients except in a metastatic disease. Now coming to the second modality of choice, that is chemotherapy. Chemotherapy is usually required for majority of the patients, especially if the tumor size is more than 1 centimeter or if the lymph node is positive. We need to give chemotherapy for all patients. What chemotherapy is used? Conventionally we use in a breast cancer two types of chemotherapy. One is adriamycin and cyclophosphamide, second group is taxane group of therapy. Taxane group. Chemotherapy is usually given either prior to or post surgery, and how many types of chemotherapy is given usually depends on the tumor size and whether the lymph nodes are involved or not involved. We usually give adriamycin and cyclophosphamide prior to the surgery, and then we take up the patient for the surgery, and post which, based on the histopathology report, if the lymph nodes are positive or the tumor size is more, for these patients we give a second group of drug called as taxanes. Coming to the third group of agents, that is targeted therapy. We usually give targeted therapy drug called as trastuzumab for any patient in whom in IHC the HER2 report is positive. Suppose if the patient has this HER2 3+, we give 1 year of targeted therapy. And now let us discuss with respect to the radiation therapy. All patients might not require radiation in a breast cancer patients. The indications for radiation in a breast cancer patient is: 1. Any patient who has undergone breast conservation therapy, radiation is a must. Second, if the tumor size is more than 5 centimeters, then radiation is compulsory. Third, if the lymph nodes are positive, then we give radiation. In the radiation also we have got different types of techniques. One is IMRT, IGRT, and conventional 2D CRT. Which technique to use, your doctor would be able to explain you according to your case. Now coming to the third modality of treatment, that is hormonal therapy. Initially when we do a biopsy or post surgery MRM specimen, we do something called as immunohistochemistry. In immunohistochemistry, if ER and PR receptors are positive, then usually we give hormonal pills. Usually the duration of hormonal pills is 5 years, but There is a study which shows if the lymph nodes are positive, we can even extend the duration of hormonal therapy up to 10 years. Thank you for patient listening. For more information, please subscribe our channel.